Well, virtualization of healthcare can take healthcare anywhere because of some huge demographic forces that are at play today and have been for the last decade, but we're only just starting to wake up to the impact.
The way our patients expect service to be delivered has changed, and the invention of these has turned everybody into Dr. Google.
Well, look, I find with patients that they often really struggle to get to an outpatient appointment. Trying to arrange a vehicle, sometimes they don't have a vehicle, they can't afford petrol, they've got to find somebody to manage their children. It's a huge barrier for them to try and get that secondary health assessment. So absolutely, it's vital that we can break down that physical barrier.
We need virtual healthcare to give us the flexibility to respond to these changing forces.
HealthTap is a secure cloud-based app that creates a patient-centred clinical record. It connects you via a video call to your doctor and other healthcare professionals.
We'll be able to make home visits by not even actually physically going there. Virtual DHB allows health professionals to link with their colleagues and also with their patients. They can do this with a mobile device, either from home or in their office, and also from a home computer. So it's a really great, versatile way of effectively having a clinician almost in your pocket, dare I say it. And it means that as a clinician, I know that there's going to be a more rapidly available service to the patient.
I've been involved in telehealth for a long time, but a problem has been that we have no integration with the GP record or the hospital record. An advantage of HealthTap is that it's integrated, and everything I do in HealthTap is recorded in the clinical workstation and in the GP's record.
We now have a place where patients can find the answers to their health questions and connect with their health professionals, and health professionals can connect with each other in a way that's easier and it's more convenient. We're also going to be able to reduce the number of outpatient visits for patients coming into the hospital.
GPs are going to find HealthTap really useful. They can virtually consult with their patients if they choose to and it fits within their business working. They can also go onto the site and do peer review or CME, something that particularly our rural colleagues find hard to do at times. I can see great benefits of my patients being signed up to HealthTap. Recently I had two quite complex patients. The first one was a dermatology patient and I sent her into one of our local dermatology specialists here at Waikato Hospital. I had an answer within half an hour and I didn't have to send in a referral. It was really pretty cool. The second one was a complex case where I didn't really know who to ask for advice, and I put out a curbside consult, and within a couple of hours I had two colleagues from overseas helping with my patient, and again prevented me from having to refer that patient to the hospital, which was perfect, something I've never had before.
I've already been arranging virtual follow-ups for my patients, about 15 of them so far, and most have been wildly enthusiastic. They think it's great that they can be from home to have their consultation.
Using this technology, we're able to have these patients connect with their specialists virtually. They can even have their GP or practice nurse sitting alongside them, which has the added benefit of a bit of skills transfer going on between our specialists and our community colleagues. I think this is great news for patients, and it's been a long time coming.
The Virtual DHB allows us to provide a more equitable, accessible way for people to manage their own health, as well as us providing an improvement in their healthcare as well.
You know, change is quite hard for some people. There's no doubt that considerable training is required to make it work for you. But the benefits are fantastic.
Putting patients in control of their own healthcare, that's a smart idea because patients do know a lot of what they need and what the best approaches are. This technology, this way of service delivery is highly mobile, highly flexible, and the patient is in control of that. Now that's remarkable and can change the way we deliver healthcare.